All right, everyone. It's just turned noon, and we are going to get things started. Um, we've got a great speaker today in our second to last Climate and Health Lecture Series talk for 2023. I want to thank all the people that have helped put this together: Stephanie Wicks, Sarah Hegerly, Michael Hobson from St. Luke's, Christine Myron, who helped us arrange things with our friends at Boise State Public Radio to have Dr. Frumkin speak on Idaho Matters yesterday. And of course, our guests themselves. Dr. Howard Frumkin is our distinguished guest today. He's a general internist and epidemiologist. He's currently the Senior Vice President and Director of the Land and People Lab at Trust for Public Land, which is a national organization that creates parks and protects land for people, ensuring healthy, livable communities for generations to come. He's Professor Emeritus at the University of Washington School of Public Health, where he served as Dean from 2010 to 2016, and previously was head of Our Planet, Our Health initiative at the Wellcome Trust in London. He was director for the National Center for Environmental Health and Agency for Toxic Substances and Disease Registry at the CDC, was a professor and chair of environmental and occupational health and professor of medicine at Emory University, where I actually took a class from him in 2002. His career is focused on health aspects of climate change. His community and professional activities include serving on numerous boards, including the National Academy of Sciences, on the boards of the Bullitt Foundation at the Seattle Parks Foundation, the Washington State Academy of Sciences, the U.S. Green Building Council, Physicians for Social Responsibility, and the American Public Health Association, and National Environmental Educational Foundation, on advisory committees for the Global Consortium on Climate and Health Education at Columbia University, the Harvard Center on Climate, Health, and the Global Environment, the Yale Center on Climate, Health, and the Medical Society Consortium for Climate and Health. So you can see from this truncated but extremely long list what an outstanding career Dr. Frumkin has had. Dr. Frumkin was educated at Brown and the University of Pennsylvania, where he received his medical doctorate, Harvard, where he received his MPH and Doctor of Public Health, and was elected a member of the Washington State Academy of Sciences and on the National Academy of Medicine. He's currently also a Hagler Fellow at the Texas A&M University. So please welcome our illustrious speaker, Dr. Howard Frumkin.
Thank you so much for that nice introduction, and good afternoon or good morning, everybody, depending on where you are. I'm going to go ahead and share my screen, and we'll jump right in. My topic today is climate change and health implications for physicians, and I'm really honored to be part of this terrific series. I don't know if this is a CME event or not. I forgot to ask, but just in case, I want to disclose that I have no financial conflicts of interest, and I do have the organizational volunteer roles that Ethan mentioned in the introduction. Well, this story that I'd like to tell begins about 150 years ago. This is the Drake oil well in Cherry Tree Township, Pennsylvania. It was drilled in 1859. This was the first commercial oil well in the United States. It's often identified as the first in the world, but that distinction may actually belong to Azerbaijan. Liquid fuel completely changed our civilization, making a lot of energy available on a very readily usable basis. And over the succeeding century and a half, up until our day, as you can see on this graph, world energy consumption skyrocketed. Much of that came from coal, a lot from oil, more recently from natural gas. Energy consumption has increased dramatically. That has led to higher CO2 emissions because those fossil fuels, when you oxidize the carbon-based molecules, turn into carbon dioxide, as you all know. And when you emit carbon dioxide levels in the air increase. So here's the trend line from the observatory at Mauna Loa in Hawaii, showing the steady increase, actually that interesting sawtooth pattern as the northern hemisphere goes into and out of the deciduous tree season. So some CO2 is sucked out of the air each year by trees that are in leaf, and then the levels rise again when the leaves fall off the trees. Now, all that energy that we're liberating from fossil fuels, where does it go? Well, here are where the greenhouse emissions occur by sector. And you can see that roughly a quarter of our greenhouse gas emissions nationally come from the transportation sector, another quarter from generating electric power. And this is declining a little bit in recent years as we've shifted from coal to natural gas, but still substantial. Another roughly a quarter in industry, and the rest in commercial and residential settings and in agriculture. Those rising CO2 levels have led to dramatic changes in Earth's systems, so much so that we really live on a different planet than the one our grandparents inhabited. The ocean pH has dropped, Arctic sea ice has decreased in size, wildfire acreage is on a irregular but generally increasing trend of burning. Sea level is rising, and global surface temperature is rising as well. I want to focus on that last one. This is a picture of trends over the last year. And what I want to point out here is that the trends are accelerating rapidly, a point to which I'll return in just a few minutes. The world surface temperature, which you see here, is above the global record for the years 2000 to 2020. The most recent year, 2022, is really off the charts in temperature terms. It's off the charts in terms of cumulative area burned in Canada. Sea surface temperature is up. So you never want to call out one year too much, because the important thing is long-term trends. But this year has really been a warning signal to us. The trends are accelerating rapidly. This is shown in a different sense here. This is a brand new slide just coming out. This looks at Septembers only. So it looks at all Septembers from 1940 to this year, and it takes as a baseline the 1991 to 2020 temperature. And what you can see is that we have this upward trend, but look what happened in 2023, this summer, this September, dramatically increased. So we've got trends that are representing global shifts, and we have what seems to be a rapid acceleration in the short term. Now, all of that has health impacts, and this is a slide that summarizes those health impacts, way more than we can possibly go into in detail in one short session today. But let me run through the catalog for you. The direct effects of heat, and I'll talk more about that in just a minute, illustrated here. The impacts of severe weather events, floods, storms, and so on, causing injuries and fatalities in the short term, and long-lasting mental health consequences. The impacts of air pollution, a little bit complicated here. Air pollution comes from the same source that climate change does, that is burning fossil fuels, and climate change worsens air pollution by driving the formation of ozone, ground level ozone. Air pollution leads to asthma, cardiovascular disease, aggravation of diseases, as well as rising mortality. Allergies are worsened by climate change because the impacts of carbon dioxide and other conditions turns out to accelerate the growth of many allergenic plants, and to make some allergens, such as urushiol and poison ivy, more allergenic. Chemical exposures are worsened because the liberation and transport of chemicals in the biosphere are accelerated by climate change. Infectious diseases, both those that are vector-borne, mosquitoes, ticks, and so on, and those that are water and food-borne, are promoted by climate change through a whole series of very interesting pathways. Threats to the water and food supply as climate change impacts agricultural productivity. And this potentially is one of the greatest global health threats from climate change. Mental health impacts. I referred a minute ago to the impacts of disasters, but there's also the depression, anxiety, and despair that come from listening to talks like the one I'm giving now, and from contemplating the changes that are occurring. And there are interesting direct mental health impacts from severe heat, especially for people with underlying mental illness. And then finally, the big picture problems: resource scarcity, running out of habitable land as some places become uninhabitable, the possibility for forced migration and for civil conflict that follows. So all of these together form the inventory of climate change health impacts. Back in 1897, when I started medical school, Sir William Osler said that he who knows syphilis knows medicine, a famous quotation. It's probably true now that if you know climate change, you know public health, because these are such far-reaching impacts. So without going into a lot of detail, let me just make three overall observations: complexity, inequity, and urgency. And we'll start with complexity. I want to illustrate complexity by talking about what seems to be the simplest climate change health impact, and that is heat. We all learned in medical school that there's a cascade of impacts from severe heat, beginning with heat rash, heat cramps. If you've ever manned the finish line at uh, a race during summer weather, you may have seen this: heat exhaustion, and finally heat stroke that can be fatal. But those things don't tell the full story. Heat waves can have substantial population impacts. 70,000 deaths during the 2003 European heat wave, 54,000 deaths in Russia during the 2010 heat wave, thousands per year in India and other parts of the global south during most recent summers. And these deaths aren't attributed to climate change on the death certificates. They're generally attributed to cardiovascular and pulmonary causes. But that's not all either. Heat threatens health in lots of other less obvious ways. Uh, Violence increases during severe weather. So does self-harm. Suicide rates rise during severe heat. Kidney disease rises during severe heat, especially among workers who don't have the opportunity to rehydrate and are stuck working in very hot circumstances. Agricultural workers, for example. Food poisoning increases because of the difficulty of keeping food clean and sanitary during hot weather. So uh, Campylobacter, E. coli, Shigella, Salmonella all rise with rising heat. Sleep is disturbed during heat, and sleep deprivation in turn is a risk factor for inflammatory conditions, metabolic and endocrine abnormalities, cardiovascular disease. Adverse pregnancy outcomes rise during severe weather. Heat affects children in another way. It compromises academic performance with a heightened impact on children from minority or poor communities. Adults react similarly. Heat reduces work capacity to the point that economic output may decline substantially in very hot places, compounding poverty in those places. People reduce their physical activity. Injuries, workplace injuries increase during hot weather, and people decrease their physical activity during hot weather, increasing the risk of cardiovascular and other adverse health outcomes. So all of this by way of saying that climate change through each of its pathways is extremely complex in the way that it threatens health. Another overall observation is that these health impacts don't occur equitably. We're all at risk, but some groups are at greater risk than others. Children are at greater risk from wildfires because of their susceptibility to respiratory disease, diarrheal disease, anxiety. The elderly are especially susceptible to extreme heat and to weather disasters, especially if they can't evacuate. People with underlying cardiovascular, pulmonary, and other diseases are at risk from a number of the health impacts that I described. And poor people, members of minority groups, are at increased risk of every adverse health outcome. I want to focus on that one just a little bit. There is a heat vulnerability index that investigators at Yale University created. They combined a bunch of factors: demographic, economic, social, the age of housing, underlying health problems, and so on, applied that index to 55,000 census tracts across the US. And what they found was a pattern shown on this map. Maybe a little hard to see in detail, but if you pull out some of the metro areas like Houston or New York, you can see that the level of heat vulnerability varies greatly. It's darkest red in the neighborhoods that tend to be the minority and the poor neighborhoods, indicating that the resiliency that people have, the ability to cope with heat, is greatly diminished in those neighborhoods. So there's an inequitable pattern of risk to climate change, in this case to heat. That has given rise to this movement that goes by the term climate justice. And the principles here are that climate change hits the poor and vulnerable the hardest. And ironically, and of moral concern, the people who are hardest hit are those who are the least responsible for climate change. They've caused the fewest emissions. Climate change doesn't necessarily introduce new hazards as much as it exacerbates underlying inequities. And that's the reason that as we move toward climate solutions, about which more in just a few minutes, equity has to be an inherent part of our thinking. And the third overarching comment I want to make has to do with equity. So this is a picture of trends in a few Earth systems: biodiversity loss, glacier loss, Antarctic sea ice loss, and weather-related catastrophes. And what I want to show you here is that the slope of these changes is increasing. The first red line that I'm highlighting here shows you the slope in years past. The next interval has a steeper slope in each case, and the most recent interval has the steepest slope in each case. Each of these global changes is accelerating in the pace at which it's occurring. The climate scientists tell us that we're approaching tipping points in Earth systems, tipping points such as Arctic sea ice or the overturning of the Atlantic meridional circulation, which accounts for the Gulf Stream, maintains the climate of much of North America and Europe. As these changes occur, so-called tipping points, they become irreversible, and they may lead to catastrophic changes in Earth systems. We may already be in the midst of some of these changes, especially with regard to Antarctic sea ice. And another indication of the urgency is shown here. This is a complicated picture. Each of these colored graphs here, or colored lines, shows you a possible pathway to limit warming globally to 1.5 degrees centigrade. Each pathway uses different assumptions about technology, about socioeconomic trends, and so on. But the key point here is that every one of these pathways assumes that we dramatically reduce our CO2 emissions starting about now, get to a 50% reduction by 2030, and get to net zero by 2050. But we're not doing it. We have not been on a pathway to a 50% reduction by the year 2030. So all of those observations spell one word, and that is emergency. There is a lot of urgency to acting on climate change. Otherwise, these health threats will become much more unmanageable than they are now. Well, all of that, the long recitation of health impacts from climate change, the fact that it is so urgent, the fact that it's occurring in unfair, inequitable ways, can be pretty overwhelming. These climate trends, their far-reaching consequences, could actually drive a person to despair. And there are plenty of voices that seem to conspire to drive despair, the so-called doomers. Professor Jem Bendell, the author of this paper, well known in some circles, tells us bluntly that there will be a near-term collapse in society. Professor Guy McPherson tells us, quote, clinging to hope is a mistake and promulgating hope is a lie. According to military veteran and writer Ray Scranton, quote, we live today in the long, dim days of decline and collapse and retrenchment and violence and confusion and sorrow and endless, unassuageable human suffering. Well, this is tough stuff to hear. Popular media increasingly describes this despair, especially in young people. It goes by various names: eco-anxiety, climate anxiety, solastalgia, pre-traumatic stress. The theme of hopelessness arises frequently. You may have heard some of these feelings in your patients. You may have struggled with these feelings yourself. We don't have a lot of quantitative data, but here's an exception. This was a 10-country survey of young people published a couple of years ago, showing very sobering results. The upper bar shows that almost all express some degree of worry about climate change, more than half in the extremely or very worried categories. The lower bars show that substantial majorities reported feeling sad, afraid, anxious, angry, powerless. Here's another survey of just over 600 Americans focused on views of reproduction. The blue bars show the level of concern about the carbon footprint of having children. Well over half the respondents were extremely or very concerned. But I want to direct your attention to the orange bars, the level of concern about the climate impacts children will face. Over 96% of respondents were extremely or very concerned. One young woman stated, "I feel like I can't in good conscience bring a child into this world." And heartbreakingly, a 40-year-old mother says, "I regret having my kids." This is sad stuff. Now, health professionals know a thing or two about caring for people facing grim news, people who are anxious or depressed or hopeless. I'm going to suggest that insights from modern psychology and psychiatry, oncology and geriatrics, palliative care might be informative. What can clinical insights teach us about sustaining hope in the context of the climate crisis? Well, let's talk about hope. I think we need to attack this issue head on. There are lots of definitions of hope. Here's a pretty standard one from the American positive psychologist Rick Snyder: the perceived capability to derive pathways to desired goals and to motivate oneself via agency thinking to use those pathways. A little bit wonky. If you deconstruct it, hope has three components: a goal, a plan, and the ability to act. And so action, the ability to act, is inherent in hope. And that differentiates hope from optimism. As David Orr has written, hope is a verb with its sleeves rolled up. Hopeful people are actively engaged in defying the odds or changing the odds. Optimism leans back, puts its feet up, and wears a confident look. Action is key to hope. I'm going to argue that we should all be in favor of hope. We should be propelling hope in ourselves, in our patients, in our communities. And I'm going to propose three reasons why I think we should do that. First, hopeful people feel better. Hope is good for people. So for health professionals whose calling is health and well-being, this is very mission aligned. Let me show you some evidence. There's a fair body of clinical evidence showing that hopeful people feel better, they handle stress better, they live longer, they have better cognitive function and better academic achievement. And conversely, the same body of evidence shows that hopeless people are at increased risk of all of the health conditions you see shown here on the left. So all in all, propelling hope is a strategy for improving health, and that's a good reason for us to be doing it. Secondly, hope leads to engagement and action, while despair leads to indifference and withdrawal. Hope gets things done. Despair gets nothing done. And at this moment in history, in the face of a climate emergency, we need action. So we need hope. And third, hope is fact-based. Despite the worrisome trends I referred to earlier, and we can't whitewash those at all, there is no basis in evidence for concluding that we've lost this fight. Propelling hope isn't feeding a delusion. There's plenty of empirical basis for it. Some of that is shown here. The technology is advancing. We're seeing better batteries, better electrical storage, advances to the grid, much more than we thought we would. The economics are improving. The prices for PV panels have dropped dramatically in the last decade. Activism is blossoming. Young people really care about this issue. Policy is maturing, from federal policy to state policy in many states to urban policy in many cities. We're seeing policies shift toward replacing fossil fuel infrastructure with renewable energy, toward incentivizing the use of electric vehicles, and so on. Public opinion is shifting. The US public across party lines increasingly cares about climate change. Culture change is possible. If you look back at history, say the Second World War, where everybody had a victory garden, people reduced their consumption, people reduced their travel, many of the things we need to think about doing now. It can happen. Results are emerging. We're seeing, for example, that the per capita carbon emissions of Americans have been dropping in the last few years. That's a good trend. We need to accelerate it, but it's very encouraging. And finally, one that I want to linger on is the story of co-benefits. This is a health-based story, and it's a reason for hope. Here on the left, I'm showing you three of the main strategies we need to implement to tackle the climate crisis. Clean energy, meaning replacing fossil fuel with renewables, uh, likely with some nuclear as well, and reducing the use of energy through conservation. Well-designed cities, meaning excellent pedestrian and bicycle infrastructure, excellent mass transit, well-designed density, energy-efficient buildings, plenty of parks and green space, and healthy, sustainable diets, meaning grown through regenerative agriculture, emphasizing plants over animal protein, minimizing food waste. These are climate strategies on the left. On the right, you see the major public health goals that we all share: less heart disease, lung disease, and cancer, better mental health, fewer infections and injuries, healthier child development. Well, here's the good news. We have solid evidence that the energy transition delivers all of those health benefits. And this is not just a rhetorical point. There's actually a body of evidence behind each of those green arrows. Similarly, we have good evidence that well-designed cities deliver all of the health benefits shown here. And we have good evidence that healthy, sustainable diets promote health in all the ways shown here. When we tackle climate change, we promote health. So tackling the climate crisis is not a story of deprivation and sacrifice. It's actually a story of opportunity and of healthier lives. That's a reason for hope as well. Now, when it comes to propelling hope in ourselves and in others, what I've tried to do is extract some lessons from the clinical literature, and I want to share those here. First, tell the truth about the climate emergency. Hope can never be grounded in falsehoods. Second, acknowledge grief in yourself and in others. As in the clinical setting, when we've lost a loved one or when we face a grim prognosis, naming and confronting grief is the first step in moving on. Third, have a North Star, a vision of the world we want, a sustainable, healthy world that we can bequeath to our kids. Fourth, identify pathways toward that vision, steps that will help get us to that world. Fifth, help build agency, the sense of personal and collective efficacy to take action. Six, cultivate solidarity. Hope, especially in the face of something as formidable as climate change, is rarely a one-person project. Working with others toward common purpose and sharing friendship and support nourish hope, much as patient support groups do in the face of serious illnesses. And finally, make room for joy. This is serious work, but there's a lot of fun to be had in tackling the climate crisis. Okay, what's the role of doctors, nurses, and other health professionals in doing all of this? Well, I think that each of us is actually more than just one person. We fill many roles as private citizen and clinician, as institutional leader, perhaps as researcher, and as trusted community voice. In each of these roles, we can act. As a private citizen, you have many decisions to make, and those decisions not only contribute to tackling climate change, they can build your personal sense of agency as well as influence your family, friends, and neighbors. So to think about what steps you might take as a private citizen, let's take a look at another pie chart, a little bit similar to the one I showed earlier on which sectors use energy. This is the carbon emissions of the average American. And what you can see here is that about a quarter of our carbon emissions on average come from the way we transport ourselves. About a quarter comes from our consumer goods that we buy. About 30%, maybe a third in all, comes from home heating and cooling and other home energy use, and some comes from our diet. Now, before I talk about the steps we can take in our personal decisions, in our personal lives to address these, let me acknowledge that there's a debate in the climate world between a focus on personal actions and a focus on system change. For my money, that's a false distinction. We need both. And we certainly need system change to tackle each of these. The system change looks something like this. When it comes to food, changing our agriculture system, encouraging sustainable, healthy diets, and reducing food waste. When it comes to transportation, we need more sustainable transportation. So moving from fossil fuel vehicles, internal combustion vehicles, to electric vehicles, moving from larger to smaller vehicles because they use less energy, shifting out of vehicles to walking and cycling if we can. All of those are system changes which require infrastructure. When it comes to the stuff we buy, a circular economy where we reuse and recycle more than produce new stuff and use less stuff. And when it comes to energy, conservation and renewable energy. So these are system changes. But at the same time, oh, and there's, of course, let me not forget to mention big uh, political system changes. This is a report just out from the IMF, the International Monetary Fund, showing the very large amount of subsidies for fossil fuel use, topping $7 trillion globally last year. So these are sort of political and system changes that we need to be thinking about. But on top of these system changes are some individual changes that we can make for ourselves and our families. Excuse me. So when it comes to food, eating less meat, shifting our diets a little bit toward plant-forward diets, reducing waste. When it comes to transportation, choosing to reduce our long-distance travel, flying less, walking and biking and using in transit, and switching to electric vehicles. When it comes to our consuming, just buying less stuff and recycling. When it comes to home energy use, reducing our home energy use, purchasing renewable energy from our utilities, and even investing our savings in banks that are not supporting fossil fuel infrastructure. That means avoiding most of the major banks and using local banks. And when it comes to home heating and cooling, go electric, install a heat pump, optimize insulation. So these are personal decisions we can make. And if you want to calculate where your particular opportunities are greatest, there are carbon footprint calculators that you can access. I've shown a few of them here, one from the Environmental Protection Agency, one from a group called Carbon Footprint, and one from the Nature Conservancy to help you identify where in your life might be the biggest opportunities to reduce your carbon footprint. We also have identities as clinicians and as institutional leaders. Now, the clinician issue is a little bit delicate, and I want to acknowledge that. Climate change, unfortunately, tragically, has become a politicized issue. It really shouldn't be. It's a shame that it is because it's a straight ahead issue of science and public health. But because it is a politicized issue, and because some folks take umbrage at talking about it, it may not be something you're comfortable bringing into the exam room or discussing explicitly. But you can model your behavior yourself. Let's say if you cycle to work, you can leave your bicycle leaning against the wall and just make a quiet statement. Or you can say to your patient, you really need to get more physical activity. Not only is it good for you, but it's good for the climate. Why don't you try walking to work instead of driving? So that sort of thing. There are gentle ways to bring this issue into patient care. You can also ask about whether your hospital or your healthcare system is taking steps to go green. Many are. This is important because the health sector accounts for 8.5% of US greenhouse emissions, some of it through the energy we use in health facilities themselves. These are energy intensive facilities. Much of that carbon footprint through the supply chain coming into our facilities is shown here. So lots of opportunities to contribute to decarbonizing the healthcare system, and lots of sources of information for how to do that. I've been involved in the National Academy of Medicine's Action Collaborative on decarbonizing the US health sector. This is really exciting and high potential work. So thinking about taking action in our capacity as clinicians and as health system leaders is the next set of options for us. And then finally coming down to trusted community voice. Do you speak out publicly on climate change? This is a real opportunity for us. This is a picture of an annual survey done by Gallup asking members of the public which professions they trust most. You'll be shocked to see that telemarketers, members of Congress, and car salespeople occupy the very bottom of this table. And look who's at top, nurses and physicians. Nurses, by the way, regularly ranking a little bit above physicians for trustworthiness. But this represents for us an opportunity and maybe even a responsibility to speak out to encourage the public to take the climate crisis seriously and to take steps to tackle it. Lots of ways to do that. One way is just letters to the editor, or the modern equivalent, which would be tweets, giving testimony both at the state and the federal level, as colleagues here are doing. Sometimes public speaking, as you see here. This is a TED Talk, but to your local Rotary, to your church, to various settings to which we have access, and even protest action for those who are comfortable with that. Here in the Pacific Northwest, I'm in Washington State, many of you are in Idaho, but we have issues that have sparked some protests, like new fossil fuel infrastructure, certainly something that's inadvisable if we want to decarbonize our economy to protect health, and something that physicians and nurses may wish to protest actively. So to sum this all up, I've tried to make the case that climate change is disrupting many planetary systems, changing our planet, and in turn threatening human health well-being through multiple pathways. The health threats are very complex. They affect different populations differently, raising some important equity concerns, and they are urgent for us to address. I've noted that these trends can lead to despair, but within this grim picture lies a lot of opportunity to make people's lives healthier and better as we tackle the climate crisis. It's essential to propel hope, and there's a lot that physicians and other health professionals can do. Thank you very much for your attention. I hope that we have time now for any discussion that you might like to undertake.
Thank you so much, Dr. Frumkin. I've got a few questions of my own, and then I would love if the audience would put questions that they have into the chat, and Sarah will bring them up and we'll go over any questions the audience has. So how do you recommend communication in a way that shows this urgency that is needed for climate action without discouraging people and driving despair? One thing I find when I'm speaking in public about this is that though I try to keep it light and I try to end on a positive note, I do feel like a lot of people come away feeling more discouraged, having seen some of the statistics, than they do without it. But at the same time, I feel like if they don't see those distressing statistics, the real emergency that we're facing is not clear to everyone.
Well, it's a great question, and I have tackled that question myself. I tried to do two things in this talk that comprise the answer to the question. One is actually to name the challenge of staying hopeful. Actually call out despair and name it, call out hope and name it, and talk about why it's so important to maintain hope. And the other, and we know this from the clinical world, is that if you just give bad news, that's pretty discouraging. But if you weld that bad news to steps a person can take, give people things they can do, that's more empowering, and it's more consistent with walking away with a hopeful state of mind. So acknowledge the problems of hope and despair, and talk about the importance of hope, and give people things they can do. Maybe painting that positive picture. But boy, imagine a world where you could walk to the places you go. People like walking. Imagine a world where the cities are full of green space. We need to put that in there for reasons of heat resilience and stormwater management and so on. But boy, that makes a town or a city or a neighborhood a livable place. So all of the co-benefits are a good news story. And I find that inspiring, and hope that that helps propel hope as well.
Yeah, and looking at your slide on propelling hope, I love that slide and that kind of stepwise process. That is not something I learned about in medical school. And that is a conversation that I think, like you said, applies just as much to the clinical context as it does to the climate context. That we need to be able to figure out how to have these difficult conversations with patients. I know that there is a movement to get climate education integrated into medical school curriculum. And I know that the University of Washington has taken steps to do that. Is this sort of hope training or hope communication training being integrated as well? Because again, having not heard anything about this until your outstanding article, which we put a link to in the chat, came out a few years ago. Um, this was something that it was just like, good luck, go get them, slugger. When you have to go break bad news to patients or talk to them about a pathway going forward.
Yeah, I think that there's growing awareness, rapidly growing awareness of the problem of climate despair. Everybody, child's psychiatrists seeing patients are talking about hearing a lot of despair from young people about this issue, and I'm hearing a lot more discussion of it. So it reminds us in the medical world that this is something we need to bring into our thinking, our knowledge base, and our actions on climate and health. So the curriculum content that you asked about, I think should not just be limited to what are the health impacts of climate change, not even how do we adapt and become more resilient, not even how do we do primary prevention and decarbonize, but also just as if you're learning about oncology or any other field of medicine, how do you communicate well with patients? And in this case, since we recognize increasingly that despair is an issue, how do you help people pivot from despair to hope? So I don't know that it's in the curriculum content that is creeping its way into medical education across the country, but I think that it will more and more.
Following up on that comment about kind of despair being more of a national emergency, I have two teenage daughters, and I do see this base. I think it's hard to tease out, but I really feel like there's a baseline level of climate anxiety that drives a lot of the troubles we're seeing in youth mental health lately. I work in the emergency department. I can't tell you the number of under 15-year-old suicidal patients I see. And yes, it is such a multifactorial problem that it's hard to say that climate is X percent of the driving point of this. But is there a national movement from national leaders like the Surgeon General, who has identified loneliness as an epidemic this year? Are national leaders like the Surgeon General looking at climate despair or climate anxiety and trying to organize some momentum around helping, really everyone, not just the youth, cope with this?
I think the answer is yes. I'm happy to say, for example, the National Academy of Medicine, which has a major focus on climate change now, is just now launching an initiative on mental health in the context of climate change that'll focus precisely on this issue. Uh, so I think the recognition's growing.
Um, the uh, continent of Africa was highlighted in the New York Times this weekend as the fastest growing locale in the world, and the home to more young people than anywhere else in the world. The youngest population in the world is in Africa. Um, are we, as a global community, working to support uh, Africa in its development so that it is developed sustainably as opposed to making the same mistakes that we've made? It seems like with
Yeah.
China being a big player there, um, Russia being a big player in parts of Africa, that we're going to have a hard time not seeing oil and natural gas pumped into a continent that has a chance to develop completely sustainably.
Yeah, boy, what a great question. And we'll all be able to pay attention to that during the COP, the Conference of Parties of the global climate apparatus that'll be meeting next month in Qatar. Um, there is a commitment in the Framework Convention on Climate Change for wealthy nations to put money toward poor nations so that they can develop in low carbon ways and so that they can build resilience, because a lot of the toughest problems like extreme heat and drought will be afflicting poor parts of the world. The problem is that the wealthy nations haven't been coming through on their commitments. So I think there's a quantitative way to answer your question, and the answer is no. The wealthy nations have not been doing enough to help developing nations move into a sustainable pathway. We need to do a lot more. And one of the things that we can do as Americans is urge our elected officials to support uh, American support for poor nations as they tackle the climate crisis.
One thing I felt during the COVID pandemic was this initial surge of community togetherness that lasted maybe 6 months. And then it really felt like that unraveled. And people became more self-interested, and a lot of the communal work fell apart. Um, I worry that that is a corollary for a climate emergency that's happening.
Yeah.
And do you have any thoughts on how we can ensure that the community stays together to work towards a common goal? Because I really feel like that pandemic ended up costing more lives than it could have had we, stuck with the experts and persisted with scientific evidence instead of getting into our holes and digging our heels in.
Yeah. Boy, I think you're touching on one of the most thorny problems we have as a nation and as a species, and that is that we go tribal. I use that word with no disrespect meant to any of the Native American tribes. I mean this in the anthropologic sense that we get together with our people and we define other people and points of view as either with us or against us. And so we politicize things. And it's no secret that the country is deeply polarized now. So the COVID pandemic response and climate change and lots of other things, which don't intrinsically have to be the subject of deep ideological dispute, become the subject of dispute. And we fight with each other about them. I think part of the solution is to move toward depolarizing our society by finding common ground. Um, in my current work at Trust for Public Land, we are really all over parks and green space and public places because there's good evidence that people come together across the divide in places like that. So that's just one little strategy that helps to do that. But listening respectfully to the other side rather than engaging in verbal combat, doing whatever we can to lower the temperature on verbal combat, reflecting our ideological divide, and emphasizing shared values. I think whatever your attitudes toward climate change, you don't want to leave your grandchildren an unlivable world. And you don't want to use a more expensive and dirty energy source when a cleaner and cheaper one is available. Uh, so there's a lot of basis for common purpose and joint effort if we can get past some of the noise that bedevils our dialogue these days. And the last thing I'll say is that uh, we demonstrate civic togetherness in the face of disasters very reliably. So, if a flood hits your town, Republicans and Democrats, blue and red, don't ask about credentials. They tend to rescue each other and care for each other. There's something almost magical about the way communities come together at the local level in the face of disaster. And the more we understand that, and are able to institutionalize that sense of caring, which is pretty fundamental to a lot of people's instincts, the better we'll do with a long-term challenge like climate change.
Great answer. Thank you very much. Some questions from the audience. How much nutrition training did you receive in medical school and nursing school, or others receive in nursing school? Much of our human health issues can be attributed to poor diets, but how much formal training is there for medical professionals on this?
Well, when I was in medical school, back in the days right after the Civil War, I had no nutrition training at all. And so I completely agree with the spirit of the question that should be a big part of the medical curriculum. And not only uh, to the point that we can advise patients on what to eat, but we can advise patients on diets and dietary practices that are sustainable as well as healthy. Because if we have a sustainable food system, and that's going to mean, it means a long conversation what that means, but one of the shifts, for example, is centering plant-based diets more than animal-based diets because the cost of producing all that animal protein is a heavy carbon footprint. Um, so the diets we learn about and advise our patients to adopt ought to be not only healthy, but also sustainable. And of course, a sustainable diet then offers knock-on health benefits as well. So for those who have access to the levers of the medical school curriculum, putting nutritional content in there and food system content in there is a terrific idea.
Yeah, I really feel like we are educated on sick care more than healthcare.
Yeah.
And I think there is a schism in the provision of those two applications in modern medicine. And we focus much, much more on sick care than we do on healthcare. And I would love to see sort of our community health division at St. Luke's work with things like lifestyle medicine to ensure that patients don't just have access to a primary care doctor who does colorectal screening for cancer, but also talks about the things you can do to prevent colon cancer in a more regular basis. So if you talk about the expansion of the Mediterranean diet to a general population, you look at great carbon savings, great health savings, um, but you really need someone to be able to talk to you consistently about how to do that.
Right.
And these Medicare annual visits you get with your primary care doctor just don't provide enough time to get through all the things you have to do
Right.
to get to that. And I would love to see sort of a building of a healthcare infrastructure more than just the sick care that we deal with now.
Amen.
Um, this is a question from the audience here. It feels like the call for individual actions is overused. That we should be recycling, that we should use less energy, that we should bike more. Do you think that this is a useful path forward, or do you have suggestions for how to engage the community to have more of a communal response to climate change?
Yeah, thanks. I think it's both and, not either or. So I guess I would disagree respectfully with the statement that calls for individual behavioral change are overstated. In the aggregate, those can make a big difference. Um, so we need incentives at the system level for the automobile manufacturers to manufacture more EVs, and we need the system change of charging stations to make it convenient to use EVs. And we need policy to subsidize the cost of EVs so that people can afford them. But none of that's going to work if customers don't buy the EVs. So there is a set of system changes and there is a companion set of individual behavioral choices that can go together. So I think, as I said earlier, we need to identify those behavior changes and encourage them and model them ourselves. But at the same time, uh, empower people and encourage people to push for the system change that we need. And the two are not unrelated in the sense that when you take personal action in your own life, it gives you a sense of agency. And we know from studies of youth activists that when they can take steps in their own lives, they feel more empowered to take steps to push for system change. So I think the two of them are complementary strategies and we need them both. Within the realm of system change, I think the question referred to actions you can take in your community. Some of that is going to be on a local level, like putting in charging infrastructure, putting in better sidewalks so that people can more safely and conveniently walk instead of drive. Some of that's going to be at the state level and some will be at the national level. And people can operate on any of those levels at which they feel comfortable. They all can make a difference.
Yeah, and I think I would say that in Idaho, we have a great need for more engagement at the state level. But we do have really good engagement from the city of Boise, and the city of Meridian and city of Nampa are becoming more involved as well, because these are important things for building infrastructure appropriately. So these city leaders are taking steps to get involved in this, and if you live in Caldwell or Nampa, tell your local representatives that you care about this because they're ready to listen. And if you have questions or interest in engaging on this, the city of Boise has been a really amazing leader that has partnered with St. Luke's and other organizations in the city, Boise State, Albertsons, on a sustainability council that has helped us look at issues like this. So there's a big need for state engagement, which doesn't mean we shouldn't try. But you're going to get a little bit more responsiveness, I think, from local city leaders
Yeah.
than you are at the state right now.
And it also, and that's true nationally, that cities have taken a real leadership position in many ways. It's really important not to overlook or forget rural people. And it's important not to browbeat folks who face a lot of barriers in adopting climate-friendly behaviors themselves. If you live in a rural area, and if there's no EV charging infrastructure, and if you need to drive long distances to get to work, then it may not work for you to switch to an electric vehicle. And that isn't a sign of moral turpitude. It's a sign of system opportunities that we need to address. So I think I completely agree that municipalities are really taking the lead in many ways, and it's important to embrace and support positive change in rural areas as well. I say that I want to call that out because Idaho is a state with large rural areas with a large rural population.
Yeah. I can see that your hopefulness has taken hold in yourself as opposed to me. You said it's an opportunity. I was saying that's a failure, but in my head when you were saying that, um, political action and policy decisions are crucial. How can we influence politicians to engage in real changes to protect the planet? The new House Speaker denies climate change is caused by carbon emissions. What are your ideas?
Well, uh, this is a huge problem, and I think historians in the future are going to look back and they're going to say, boy, why in the face of an existential crisis did they devolve into sectarian fighting with each other uh, when they could have all been rolling up their sleeves and working together? I mean, you don't have different Republican and Democratic approaches toward earthquakes. We know we don't like them, and we put building standards and uh, disaster recovery procedures in place. We should be, I think, attacking climate change the same way, but alas, we're not doing that. So I think if you have access to politicians who are not supportive of climate-friendly policies, let them know that you would hope they would support them. It's also possible to embrace policies that are very climate friendly without having to frame them as climate policies. Uh, you know which state in the union has the most installed wind capacity of any state? It's Texas. And that all happened in Texas without a lot of reference to climate change. It happened because wind is cheap and they have lots of wind available and it's good business. So I think many of the positive steps we can take bypassing some of the the difficult climate debates and just embrace steps because they make good sense in other ways.
Well, I want to thank you so much, Dr. Frumkin. It's 12:57, so I'm going to just add one last comment, and then we'll wrap things up. In response to some of the stuff you talked about in terms of what you can do at your home, our next speaker is Dr. Gaurav Basu from Harvard University. He'll be speaking on the 15th at noon Mountain Standard Time. And he'll be talking about health equity issues, but also spending about 15 minutes talking about electrifying his home, which he has done recently and written about extensively. So that's a great opportunity to see how someone's done this successfully. And then in January, we're going to have our first talk of next year's series. We're going to have 10 talks next year, one a month, excluding June and July. So everyone can have a summer off. And in January, we'll be having speakers from Idaho Power, from the city of Boise, talk about the Orange Bag Energy, Hefty Energy Bag program and what they're doing with that kind of recycling, to talk about green power programs and how you can get involved in rebates and cost savings in electrifying your home. And then also a speaker from Acclimate, which is a local business that helps with carbon offsetting and determining your carbon footprint. So a lot of opportunities in the coming talks to hear about what you can do at home. And I want to thank Dr. Frumkin for an outstanding talk that has left me feeling more hopeful for sure.
Thank you so much. Really good to be with you all today and wishing everybody a good day.
Thank you so much.
Thank you.